Right, so I need to continue on some disorders which are similar to SCAR3. And as we said, SCAR3 is spinocerebellar ataxia. And a very close resembling disorder for SCAR3, which has the same mobility problems, balance problems, the vision problems, visual problems, even the speech problems. It is called PSP, and I'll tell you what PSP means at the end of the video. It is a rare condition just like SCAR3, in that there's just 100,000 people in the world, just a little bit below above that. Approximately 100,000 people in the world who has this disorder. And like SCAR3, about 4,000 people in the UK has this disorder. It can cause risk of falls the same way like SCAR3, in that it causes stiffness of the muscles, slow walking, and risk of falls. So like SCAR3, the only difference between this disorder and SCAR3 with PSP and SCAR3 is that PSP is sporadic. It is not inherited. Actually, when I first contracted SCAR3, I thought it was PSP because they were so closely related. Except that when I discovered that it's not genetic, that is PSP, it's not genetic, then I reverted, then I realized this was SCAR3 that I had, which is spinocerebellar ataxia. Although some people there may be a genetic mutation on the PSP, which causes a protein called tau to not be used by the brain properly. So that tau builds up, and therefore occasionally it causes memory problems, problem with thinking in the later stages. Also, it develops between the ages of 60 and above. So, which is slightly different from SCAR3 in that it starts at older age. So from 60. And that's the difference. So if you realize you're getting symptoms earlier, like in your 40s, it most likely is spinocerebellar ataxia. But if symptoms develop after the age of 60, and especially when there's no family history, then most likely it's PSP. And PSP means progressive supranuclear palsy. Progressive supranuclear palsy, and it affects the cerebellum or the hindbrain, similar to SCAR3. So that's why it affects balance, mobility. Later stage, it affects the eyesight. It causes slowness, causes muscle stiffness, all the same similar symptoms to SCAR3. And I can testify to that. They very closely resemble each other, except that it's not genetic.